If you're researching a Sunwave Health alternative, the question isn't clinical features. It's everything your software ignores once care ends. Most behavioral health platforms cover clinical documentation and billing, then leave property, vehicles, and staff credentials to spreadsheets. Sunwave Health versus Behave Health, a side-by-side look at CRM, clinical documentation, billing, and operations for behavioral health organizations. We compare the two platforms across admissions, clinical workflows, revenue cycle, and the operational tools that run a treatment center. Both Sunwave Health and Behave Health are purpose-built for addiction treatment and behavioral health. They differ in scope and the range of organizations they serve. Based on publicly available information, Sunwave Health appears to focus on treatment centers and behavioral health facilities. Behave Health serves those same facilities plus recovery residences, sober living, peer support, drug courts, and NARR affiliates. Choosing the right EHR is one of the most consequential decisions an operator makes. Getting it wrong means months of migration pain, staff retraining, and revenue disruption. The software touches every part of daily operations, from the first inquiry call through documentation, billing, and alumni follow-up. The most significant difference is what happens outside the clinical record. Behave Health includes an ERP layer designed to manage the operations a treatment center actually runs on. Property management, human resources, vehicle tracking for transport, and maintenance scheduling, alongside the clinical and financial workflows. Based on publicly available information, most EHR platforms, including Sunwave Health, do not appear to include these operational tools. Let's walk through the 4 areas that decide which platform fits your workflow: admissions, clinical documentation, billing, and operations. Each area is where an all-in-one platform either saves you duplicate work or leaves you stitching systems together. First, the admissions CRM. Sunwave Health appears to offer lead tracking, referral management, and tools to manage the admissions pipeline. Behave Health's CRM centers on speed to admission, with online patient applications and instant verification of benefits during the inquiry call. A patient record created during the admissions inquiry flows directly into clinical documentation and billing without duplicate data entry. Second, clinical documentation. Sunwave Health appears to offer treatment planning, progress notes, and assessment tools to support behavioral health workflows. Behave Health's EHR includes ASAM criteria assessments, COWS and CWAS scoring for withdrawal management, and group therapy notes with attendance tracking. E-prescribing via Doctor First with EPCS, inventory, and MedPass workflows, which can reduce reliance on a separate EMAR system. Third, revenue cycle management. Sunwave Health appears to include claims management and billing workflows alongside clinical documentation. Behave Health's RCM is integrated into the clinical workflow, so documentation supports billing from the point of care instead of being reconstructed after the fact. Eligibility verification, claims submission, automated ERA and EOB reconciliation, and denial management with appeal tracking. Fourth, operations. Running a treatment center means managing properties, vehicles, staff credentials, and maintenance, far more than clinical care and billing. Behave Health's ERP layer covers property management, vehicle tracking, HR and credentialing, maintenance scheduling, and community and vendor contacts. Without an ERP, organizations typically piece together spreadsheets, separate property software, and manual processes to handle these functions. On clinical and billing, both platforms appear to cover the core. The gap opens on operational tooling and the range of organizations served. Based on publicly available information, Sunwave Health appears to offer CRM, EHR, and RCM. Behave Health adds an ERP layer in the same system. Feature availability is based on publicly available information as of April 2026. Contact each vendor directly to confirm current capabilities. If you're a current Sunwave Health user weighing whether to switch, Behave Health provides a structured migration path designed to protect your operations and revenue cycle. Behave Health's team handles data migration, so your historical records move with you. Staff training is part of the transition, so your team is ready on day 1. Parallel go-live support is designed so the switch does not disrupt operations or your revenue cycle. Common reasons organizations explore Sunwave alternatives point to one theme: wanting a modern, all-in-one system instead of disconnected tools. A single platform that combines admissions, clinical documentation, billing, and operations, purpose-built for behavioral health. lead tracking and referral analytics built around speed to admission, the revenue engine for treatment centers. Designed to support programs beyond clinical treatment, recovery housing, and peer support, without a second platform. Stop running operations outside your EHR on spreadsheets. Book a 20-minute demo at behavehealth.com. See how CRM, EHR, RCM, and ERP work together in one platform at behavehealth.com.